Hello everyone. Our presentation today will discuss sleep-wake disorders. This presentation was completed by Okege, Janus, Imelda, Madia, Jessica, and Sadia. So within this presentation, we will be discussing the background, characteristics and symptoms of insomnia, narcolepsy, and sleep anemia, their causes, forms of treatment, and examples within media of how these disorders are portrayed. Insufficient sleep is often associated with a range of adverse health effects. Sleep problems are one of the most common issues for adults who receive primary care. Having sleep issues is often associated with a steady decline in overall health, which results in negative social consequences. Many of the factors affecting sleep can include exposure to artificial light, work demands, or difficult family dynamics. Individuals with sleep problems have also reported higher levels of anxiety, physical pain and discomfort, and cognitive deficiencies. So within this presentation, we will be covering 3 sleep disorders. The first being insomnia, the second narcolepsy, and lastly sleep apnea. Let's begin with insomnia. So insomnia is a common sleep problem that can affect your quality of life. People with insomnia have trouble falling asleep or staying asleep. Insomnia is the most prevalent sleep disorder and affects a large proportion on a situation, chronic, or recurrent basis. Individuals suffering from insomnia may have trouble concentrating, remembering, or completing daily tasks, along with the high risk of accidents. Prevalence for insomnia can range from 6 to 48% across Canada, depending on the definition used. For example, 25% of adults are dissatisfied with their sleep. 10 to 15% have reported symptoms of insomnia associated with daytime consequences, and only 6 to 10% meet the criteria for insomnia disorder when assessed by a healthcare professional. Criteria for insomnia disorders require that sleep symptoms cause significant distress or functioning within social, academic, or behavioral, or even other areas. And it should be treated according to the American Psychiatric Association Diagnosis and Statistical Manual, also referred to as the DSM. So, narcolepsy. Narcolepsy is a chronic neurological disorder. It occurs equally in men and women and is thought to affect roughly 1 in 1,000 people. The symptoms of narcolepsy appear within childhood or adolescent years. However, many people present symptoms earlier and before getting properly diagnosed, as it may take greater than 10 plus years to fully develop. People with narcolepsy often find it difficult to stay awake for long periods of time, regardless of the circumstance. Narcolepsy can cause serious disruptions in your daily routine. Sleep apnea. So reported between 2016 and 2017, 6.4% of Canadians were diagnosed with sleep apnea from a healthcare professional. Sleep apnea is a potentially serious sleep disorder in which breathing repeatedly starts and stops. It affects both men and women. However, diagnosis between sexes differ. Males tend to display classic symptoms such as snoring or trouble breathing in comparison to females who exhibit symptoms of fatigue and insomnia. Females have also reported feeling sleepy and fatigued during the daytime. So now we'll be moving on to the characteristics and symptoms of insomnia. Insomnia is described as the difficulty of initiating sleep or staying asleep, or non-refreshing sleep in combination with some form of daytime sequence. Insomnia can affect anyone, but it is considerably more common in women and older adults. Women are 1.4 times more likely than males to suffer from this disorder, and older adults have also reported a higher prevalence of insomnia, due to the aging process being accompanied by changes in sleep patterns. Insomnia can last a few days, weeks, or continue long term. The DSM-5 states that an individual is experiencing insomnia if they have a predominant complaint of dissatisfaction with sleep quality or quantity associated with one or more of the following symptoms. The first being difficulty initiating sleep, the second, difficulty maintaining sleep, characterized by frequent awakening or problems returning to sleep after awakening, and the third is early morning awakening with inability to return to sleep. The sleep difficulty should be present for at least 3 months. Additional symptoms include daytime sleepiness, reduced ability to concentrate, and irritability. So there are a few types of insomnia. Each type differs in how long it lasts and how it affects the individual's sleep and the underlying consequences. The first type of insomnia is acute insomnia, also referred to as short-term insomnia that can last for a few days to a few weeks. It is the most common type of insomnia. It is also referred to as adjustment insomnia because it typically occurs when you experience a stressful event such as the death of a loved one or starting a new job. The second type of insomnia is called chronic insomnia. It is insomnia insomnia is typically considered chronic if you have trouble sleeping for at least 3 days per week for at least 1 month. Some people with chronic insomnia have a long-standing history of difficulty sleeping. Chronic insomnia has many cases. The third type of insomnia is onset insomnia. Onset insomnia is trouble initiating sleep. This type of insomnia can be short-term or chronic. And the fourth type of insomnia is maintenance insomnia. Maintenance insomnia includes the difficulty to stay asleep or waking up too early and having troubles getting back to sleep. This type of insomnia causes you to worry about not being able to fall back asleep and not getting enough sleep. This interferes with sleep further and it creates a vicious cycle. So, continuing on the causes, insomnia can be caused by many different factors such as a change in sleeping condition, intake of stimulant medication, caffeine, nicotine, nocturia, pain, anxiety, and stress, all of which can cause an occurrence of any of the 4 forms of insomnia previously listed. Some of the causes are more closely linked to a certain type of insomnia. However, this does not indicate that a specific cause is only limited to that type of disorder. Incidentally, stress, anxiety, and pain are consistently caused, and it is found to contribute to each form of insomnia. So stress and anxiety. Stress is built up from a number of different factors: physical, emotional, environmental, and spiritual, which often disrupts a range of bodily reactions in the brain and nervous system, endocrine system, and immune system. It is hyperarousal, a body's high alert as a result of thinking about the stressor or caused trauma, manifests as the inability and interrupt sleep. The second is pain. So pain can make it difficult to go to sleep at night, causing frequent awakenings from sleep during the night. People experiencing pain can also be more prone to stress. If you have chronic pain, your nervous system becomes more active, leading to an interference with how quickly you fall asleep and how deep a sleep you get. The third is nocturia. So nocturia is caused by excessive urination at night, most often associated with diabetes insipidus. Having high blood glucose levels can cause the body to excrete excess glucose via the urine. In this instant, more sugars appear in the urine and stimulate extra volumes of urine and it can be produced. And the last one is stimulant medications, caffeine, and nicotine, and they are all inhibit sleep if taken in excess. So now we move on to the characters and symptoms of narcolepsy. Narcolepsy is a neurologically based chronic hyposomatic type of sleep disorder which typically appears in childhood, adolescence, or young adults. Symptoms of narcolepsy usually begin between the ages of 15 to 25, but it is possible to start experiencing symptoms at a much younger age or older age. In narcolepsy, the normal boundaries between awake and asleep are blurred, so characteristics of sleeping can occur while a person is awake. For example, cataplexy and the muscle paralysis of REM sleep occur during waking hours. It causes sudden loss of muscle tone that leads to slack jaw or weakness of the arms, legs, or trunk. People with narcolepsy can also experience dreamlike hallucinations and paralysis as they are falling asleep or waking up, as well as disrupted nighttime sleep and vivid nightmares. The DSM-5 states that an individual is experiencing narcolepsy if any of the following are met. If they have A, recurrent periods of an irresistible need to sleep, lapsing into sleep, or napping occurring during the day. These also must occur at least 3 times per week over the past 3 months. B, the presence of at least one of the following: episodes of cataplexy occurring at least a few times per month as defined by either A, an individual with long-standing disease, brief, either seconds to minutes, episodes of a sudden, bilateral loss of muscle tone with maintained consciousness that are participated by laughter or joking, or the second is in children or in individuals within 6 months of onset, spontaneous grimaces or jaw opening episodes with tongue thirsting or global hypopnea, without any obvious emotional triggers. Hypocretin deficiencies as measured by the CSF, hypocretin 1, immunoreactivity values of 1/3 or less of those obtained in healthy subjects, usually the same AC. Or lastly, nocturnal sleep polysomnography. showing rapid eye movement, also referred as REM, sleep latencies of 15 minutes or less, or multiple sleep latency test, showing a mean sleep latency of 8 minutes or less, and more than 2 sleep onset rapid eye movement periods. So furthermore, signs and symptoms include extreme daytime sleepiness, falling asleep without warning, often referred to as sleep attacks, difficulty focusing or staying awake, and waking often at night. Other common symptoms that occur when falling asleep or waking up are hallucinations and sleep paralysis. Sleep paralysis is described as the feeling of being awake, however, being unable to move for several minutes. People who have narcolepsy usually feel refreshed after a brief nap or a full night's sleep, but become sleepy again soon after. So the causes of narcolepsy differ whether or not cataplexy is involved. When cataplexy is present in narcolepsy, it is caused by the lack of chemical hypocretin in the brain, which promotes wakefulness and regulates REM sleep. On the other hand, narcolepsy without cataplexy includes most of the same symptoms, but its causes are unknown. When cataplexy is present, the cause is most often the loss of brain cells, often linked to abnormalities in the immune system. Autoimmune disorders often occur when the body's immune systems turn against itself and mistakenly attack healthy cells or tissues. Individuals with narcolepsy are presumed to have an autoimmune disorder where the body's immune system selectively attack the hypocretin-containing brain cells because of a combination of genetic and environmental factors. Rarely does narcolepsy ever result from an injury. However, in some instances, an injury or the formation of tumors and/or other diseases to the hypothalamus and brainstem occur in narcolepsy. This is because the hypothalamus is in charge of regulating the production and balance of hypocretin. When the normal function is altered, it affects the production of hypocretin. Most cases of narcolepsy are sporadic, occurring randomly rather than being inherited. There are instances where narcolepsy is passed genetically, however, someone is rarely predisposed by a genetic component. The cause of this disorder is due to neurons lost in the hypothalamus, which produce the hypocretin essential for the neurotransmitters in the CSF that is associated with wakefulness. In severe cases, there is a 85 to 95% reduction in hypocretin neurons. Hypnagogic hallucinations, paroxysmal muscle weakness, and sleep paralysis are also other side effects individuals may experience. A common misconception of this disorder includes the assumption of low intelligence and poor motivation. Other health outcomes may include mental illnesses, disorders of the digestive tract, endocrine system, and the cardiovascular system. So now we move on to the characteristics and symptoms of sleep anemia. So anemia is the complete interruption of breath for at least 10 seconds. Sleep apnea is a disorder in which breathing will repeatedly start and stop. It occurs when the upper airway becomes blocked repeatedly during sleep, which will result in reduced airflow, also known as obstructive sleep anemia. So there are two types of sleep anemia. The first being obstructive sleep anemia and the second being central sleep anemia. So for the first one, it is the most common form of the two types and is caused by airway blockage. The second, central sleep anemia, is caused by the brain failing to signal the muscles to breathe due to instability in the respiratory control center. Complex sleep anemia syndrome occurs when someone has both obstructive sleep anemia and central sleep anemia. So, chronic snoring is a strong indicator of sleep apnea and should be evaluated by a healthcare professional. Since people with sleep apnea tend to be sleep deprived, they may suffer from sleeplessness and a wide range of other symptoms. The most common symptoms and signs of sleep anemia include loud snoring, episodic in which you stop breathing during sleep and it is typically reported by another person, gasping for air during sleep, awakening with a dry mouth, morning headaches, difficulty staying asleep, also referred to as insomnia, excessive daytime sleeplessness, difficulty paying attention while awake, and lastly, irritability. So, a diagnosis of sleep anemia under the DSM-5 must meet either criteria 1 or 2. So criteria 1 includes the evidence by polysomnography of at least 5 obstructive apnemias or hyponemias per hour of sleep and either of the following sleep symptoms, as listed above. And the second is the evidence by polysomnography of 15 or more obstructive anemias and or hyponemias per hour of sleep regardless of accompanying symptoms. If left untreated, symptoms of sleep anemia can include high blood pressure, heart attacks, congestive heart failures, cardiac arrhythmia, stroke, or even depression. Sleep anemia can be caused by a person's physical structure or medical conditions. This condition results from a combination of genetic, health, and lifestyle factors and include obesity, large tonsils, endocrine disorders, neuromuscular disorders, heart or kidney failure, certain genetic syndromes, and premature death and premature birth. Physical obstruction caused by thickening tissues or excessive fat stores around the airway restrict airflow. Excessive Excessive abnormal fats can also prevent the lungs from fully expanding and relaxing, leading to sleep apnea. Central sleep apnea, also referred to as CSA, is a problem associated with brain functioning and the neurological controls for breathing. It causes a malfunction in the control and rhythm of breathing, and it is often associated with the underlying medical condition such as stroke, heart failure, and recent ascent to high altitudes or the use of pain relief medication. In premature babies, the part of the brain and spinal cord that control breathing is not yet mature enough to allow non-stop breathing. Apnea of prematurity can cause babies to have large bursts of breath, followed by periods of shallow breathing or stopped breathing. So to address insomnia, cognitive behavioral therapy is strongly recommended. Cognitive behavioral therapy for insomnia, also known as CBTI, aims to reduce persistent elements that perpetuate insomnia. So CBTI treatments focus on cognitive therapy, sleep restriction, stimulus control, sleep hygiene, and relaxation techniques, which can also be used as their own separate treatment. The cognitive therapy component of treatment focuses on challenging beliefs and attitudes that serve to maintain insomnia. Sleep restrictions help consolidate sleep by shortening the amount of time spent in bed. For example, if a person has stayed up the whole night the day before but only allowed themselves 4 hours of sleep the next day, they would likely be tired, which would result in an increased drive to sleep. Another element of CBTI is stimulus control. This technique aims to regulate sleep by limiting the amount of time spent awake in bed and help reassociate the bed with sleep rather than possible anxiety associated with insomnia. So to limit the time spent in bed, patients are encouraged to only use the bed and bedroom for sleep and sexual activities, to leave the bed and bedroom if they are unable to sleep within 15 minutes, and only return when they are sleepy. This treatment is relatively short-term and includes 4 to 8 sessions. And other forms of treatment of insomnia include prescription medication and over-the-counter sleep aids. So moving on to narcolepsy. A combination of treatments are used to manage narcolepsy, including pharmacological and behavioral approaches. Although the neurological origin of this condition warrants medications as the primary treatment approach, combining pharmacological treatments with cognitive behavioral therapy has demonstrated positive effects on successful symptom management. Many features of narcolepsy, such as disordered eating, hypersomnia, and depression, require cognitive behavioral therapy. CBTI for narcolepsy focuses on addressing these key factors and managing behaviors such as medication adherence and encouraging good sleep hygiene techniques. It is important to highlight that although CBT is not entirely effective at managing all symptoms, it significantly improves the quality of life for those with narcolepsy. So the primary treatment for sleep anemia is continuous positive airway pressure, also known as CPAP. CPAP continuously provides air pressure when you sleep. The air pressure provided by the CPAP is slightly greater than the air in the surrounding environment. This pressure is just enough to keep your airway passages open, preventing snoring and apnea. This is the most effective method of treating sleep apnea, though some patients find it uncomfortable. And lastly, another symptom of Another method of treatment is surgery of the airways. However, this is usually used as a last resort. So a study conducted by Marks, McKeon, and Vogue in 2019 aimed to test the efficiency of cognitive behavioral therapy for insomnia on patients with chronic tendinitis and insomnia. The study included 24 adult participants who received 6 sessions of group-based CBTIs involving stimulus control, sleep restrictions, cognitive restructuring, relaxation training, and sleep diary monitoring. There were also tendinitis-focused elements, which include teaching participants the shared process in tendinitis and insomnia, psychoeducation about tendinitis, and providing a sound machine to sleep. To test the effectiveness of this treatment, measurements of insomnia, sleep diaries, tendinitis distress, psychological distress, anxiety, and depression were completed per intervention, post-intervention, and at 6 weeks follow-up. Results indicated that 66.7% of participants experienced reliable improvements in insomnia severity, which was sustained by 54.2% of participants to follow-up. There were also improvements in primary sleep outcomes, such as sleep efficiencies, which increased by 12.7%, and sleep onset latencies, which was reduced by 11.7%, and then further reduced by 8.5 minutes through follow-up. Participants also experienced reductions in secondary outcomes such as depression, anxiety, and tendinitis-related psychological distress. However, sleep times did not increase, which was likely due to the fact that CBTIs focus mainly on sleep consolidation before increasing sleep times, suggesting that a longer treatment time may be necessary for further studies. So the study had minimal exclusion criteria, which was actually quite beneficial to help getting the largest sample size possible. Nonetheless, this study still had a small sample size, which can affect its statistical power and generalizability. There was also missing data for 7 participants at the final session and 9 at follow-up, further reducing the generalizability of the study. This experiment also had a relatively short follow-up period for 6 weeks. It would be interesting to see whether results are sustained past this follow-up period. This study adds to the growing evidence that CBTIs can have positive effects not only on primary insomnia but also on insomnia that is secondary to another condition. This treatment approach requires further research, preferably using a randomized controlled trial to minimize biases. So now we move on to stigma within the media. So stigma and discrimination often go hand in hand with discussing mental health. 1 in 5 Canadians experience a mental health problem or illness each year. And although common, mental health continues to meet widespread stigma within hospitals, workplaces, schools, rural and urban communities, and even amongst close family and friends. So for the first one, we'll be talking about Awake. Awake is an experimental documentary filmed by Martin Roxkull, and it explores the relationship between sleep and mental health and multiple sclerosis. The film occurs over one night, recording late-night phone calls of patients reflecting from their unique perspectives of experiencing both insomnia and a neurological disease, depicting real experiences and highlighting the struggle that occurs between individuals for their inner peace. The film emphasizes the struggle associated with having to carry on with keeping with daily activities while being almost to the point of exhaustion. The film represents real stories of people struggling with insomnia and gives an accurate portrayal of what these individuals have to deal with. Nearly every person within the film battles with self-stigmatization, and a study by Chan and Fugi highlights the contribution of internalized stigma when evaluating sleep quality, and health status of individuals with mental disorders, accurately depicting what people with insomnia face and how they don't often receive help. The second is Perception. Perception is an American crime drama television series created by Kenneth Briller and Mike Susan, and it follows Dr. Daniel Pierce, a neuroscientist who uses his unique outlook to help the federal government solve complex criminal cases. So season 2 introduces a character diagnosed with narcolepsy, briefly mentioning symptoms of excessive sleeplessness, cataplexy, sleep paralysis, and hypomagnetic hallucinations. Perception accurately portrayed symptoms of narcolepsy within that character. So the third one is A Nightmare on Elm Street. In 1984, it was directed by Wes Craven and portrays similar symptoms to sleep apnea. So although no character is diagnosed with sleep apnea within the film, villain Freddy Krueger invades and kills people within their dreams, making each character too afraid to fall asleep. Similar to sleep apnea, an individual's breathing repeatedly starts and stops, obstructing sleep and causing tiredness during the day. The film portrays symptoms of irritability, difficulty paying attention when awake, and headaches among the characters, accurately portraying symptoms of sleep apnea. So in summary, insufficient sleep can lead to many adverse health effects. To highlight, insomnia is associated with a difficulty in initiating sleep or staying asleep. It can last a few days, weeks, or long term and include characteristics of acute, chronic, onset, and maintenance insomnia. Treatments include insomnia cognitive behavioral therapy. Narcolepsy is described as neurologically based chronic hyposomatic. Onset is between 15 to 25 years and causes a dreamlike hallucination and paralysis. Symptoms include daytime sleeplessness, sleep attacks, and difficulty focusing or staying awake, and treatment includes pharmacological treatment combined with cognitive behavioral therapy. Lastly is sleep apnea. It involves the complete interruption of breathing for at least 10 seconds. Some characteristics include loud snoring, insomnia, poor concentration, irritability, and hypersomnia. And it is caused by a person's physical structure or medical condition. The most effective treatment include continuous positive airway pressure. However, if not enough, patients can have surgery as a final resort. We hope you enjoyed our presentation and learned more on sleep-wake disorders. Thank you. And here are our references. Thank you.